Hello everyone, welcome to my YouTube channel. I'll be talking to us again about a question that has to do with American Society for Clinical Pathology exam. Like I've said many times, even though this is where I've gotten this question, but this question can also, appear in any pathology exam or interview, like biomedical scientist interview, or as the case may be. So please, I want you to do pay attention to that. So we're going to be looking at something that has to do with maybe allo antibody. But before I continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So let's dive into this, properly. So the question goes this way. A patient has a forward type group. A patient has a forward type of group A. A patient has a forward type of group A, but the reverse type, shows anti-A. What is the most likely cause? Now, let me repeat this question, then I'll explain it more, just for better understanding. A patient has a forward type of group A, but the reverse type shows anti-A. What is the most likely cause? Now, let's forget about the most likely cause first. Let us understand what is going on here, So remember, when we are doing blood grouping, we have forward grouping, we have backward grouping or reverse grouping. Now remember, I have told us that when you talk about hematology and blood bank, anytime you say direct, it is on the surface of the red blood cells. Another thing I want you to also remember, anytime you say forward, what you are measuring is on the cells. Anytime you say backward or reverse, what you are measuring is the plasma. The same way, when you say direct is on the cells, indirect is in the plasma. Also, when you say forward is on the cells, when you say backward or reverse is also in the plasma. Does that make sense? Now, if you've understood that, what it means that when we look at forward grouping, what we are measuring is the antigens on the surface of the red blood cells. When we look at reverse grouping, what we are then measuring is the antibodies in the plasma. Just for the record, remember that the antigens are found on the surface of the cells, of any cells, but on this occasion, we're looking at the red blood cells. So antigens are found on the surface of the cells, like red blood cells, and then antibodies can be found where? In the plasma, or serum, as the case may be, Now, if you've understood that, so when we do blood grouping, we do forward grouping to check the antigens on the surface of the red blood cells. We also do the reverse grouping to check the antibodies in the plasma. That way, we are doing two grouping together. So we are doing forward grouping, we are doing reverse grouping. That way, we want to make sure that the reverse group agree with the forward and the forward agree with the reverse. It gives us confidence that the result we've obtained is accurate and reliable. Does that make sense? Now let's go back to the basic. So when somebody is blood group A, the person should have antigen A and antibody B. When somebody is blood group B, the person should have antigen B and antibody A. When somebody is blood group AB, the person is going to have antigen A and B and no antibodies. And when the person is blood group O, the person will have no antigen A, no antigen B, but antibody A and B. Now, just for the record, remember the antigens I'm saying present or not present are not IgGs. I'm referring to IgM, antigen A or antigen B or antibody A or antibody B. They are IgM antigens or antibodies. I hope that makes sense. Because the reason why I'm saying is that there is no blood cells, there is no blood group that does not have antigens. But if you are referring in terms of IgM antigens or antibodies, yes, some of the, like blood group O does not have IgM antigen A and antigen B, but it has IgM antibody A and antibody B. And blood group AB does not have IgM antibody A and antibody B, but has IgM antigen A and antigen B. Now, I'm only saying that to say that where you say, when I say blood group, this blood group doesn't have this antigen or has this antigen, what I'm looking at is the IgM, not IgG, because every blood group has IgG antigens. I hope that makes sense. If we've understood that, let's now focus with the question. A patient has a forward type group A. That means the forward grouping of the patient is group A. That's what he's saying. We have done the blood group of a patient. The forward group has been tagged to be what? Group A. The forward group is group A. Remember what I told you. If the person is blood group A, the antibody is supposed to be antibody B. Blood group A should have antigen A and antibody B. That antibody B should be seen in the reverse group. Does that make sense? But look at the question. A patient has a forward type of group A, but reverse type shows anti-A. So that means in the reverse grouping, we are also seeing anti-A. Maybe it shows us anti-B, which they didn't specify, but I want to believe that it shows anti-B, okay? But again, in addition to that, it shows anti-A as well. So why the anti-B, confirm that this person is blood group A, but why are we getting anti-A? That is ABO discrepancy. That means it did not agree, because the only blood group that's supposed to show you anti-A and anti-B is supposed to be blood group O. And if it is blood group O, it shouldn't have antigen A. Does that make sense? Okay. Now, because of the blood group A is supposed to have antigen A and antibody B, but unfortunately, the antibody is showing us anti-A. We need to investigate that. So the question is, what is the most likely cause? Now, because of the technicality of this question, that is why I'm taking my time to explain this. So let's read the question again. A patient has forward type of group A. A reverse typing shows anti-A. What is the most likely cause? A, technical error. B, code autoantibody. C, acquired B phenomenon. Okay. D, group A with an allo antibody. Okay, now let's go a little bit back. Okay, remember, he said, what are the most likely cause? So there are a number of things from what they said there that could cause it. In fact, technical error could lead to that. Okay, yes, it can lead to that. Okay, but what is the most likely cause? If everything is normal, what should be the most likely cause? So now I'm going to first of all tell us the answer. Then we go back to everything. The answer here has to be D, which is that group A has some allo antibody. Now, let me explain it this way. Now, first of all, we need to look at two types of antibodies. We have autoantibody, we have allo antibody. When you say autoantibody, it means that the person's system is responding against itself. So when somebody body began to see his or her antigen as foreign and develop antibody, that antibody that the person body develop against his or her own antigen is autoantibody. Okay, but if someone is given a blood product, and because that antigen is coming from outside, and the person body see, oh, this, I don't know this antigen, and began to respond and develop antibody, that becomes allo. So allo antibody, they are acquired antibody. When you expose a foreign antigen to someone and the person develop antibody, that is allo antibody or acquired antibody. But when you say auto antibody, no, it is the person system, producing that antibody against his or her own antigen. I hope that makes sense. Okay, if you look at that option, there are a number of things that could contribute to that, but I will go more for D, which is actually group A, allo antibody. But before that, let's look at the reason why it could be any of those things. First of all, there are different types of blood group A. Okay, so if you have a weaker version, which is maybe blood group A2, or maybe even another subtype of the weaker version, okay, what is going to happen? That weaker version is then likely to produce anti-A1. Okay, anti-A1, and that anti-A1 may then show that reaction in the reverse grouping, because the reverse grouping is mainly measuring A1. Does that make sense? Okay, and I think I've done a video on that where the solution is to try to determine using anti-A1 lectin. Okay, so with the anti-A1 lectin, it can be able to help us to know whether it is actually the A2 or any of the sub weaker blood group A. Does that make sense? Okay, now, so I'm saying that is possible if the person has a weaker blood group A, like A2, another version, that may have developed that very A1 anti-A1 antibodies, okay? But now it could also be due to cold autoantibody or allo antibodies, okay? Because I'm trying to tell you why I'm going with blood group A with an allo antibody, because cold antibodies can also lead to that. But let's continue. So it could be either cold autoantibody, it could also be due to allo antibody. Now, when you look at a kind of non-specific cold reactive antibodies, okay, maybe when you look at something like maybe anti-I or any of the cold antibody, okay, this cold antibody may interfere on the reverse grouping. Does that make sense? So when you have a non-specific cold reactive antibodies, that non-specific cold antibodies or cold reactive antibody may interfere on the reverse group. So now, what did they mean? That these very non-specific cold reacting antibodies can mimic that very anti-A. So that anti-A that non-specific cold reacting antibody mimic can be why you are seeing that reaction in the anti-A1, anti-A cells. Does that make sense? So I've mentioned two things. It could be due to a weaker version of blood group A that has developed maybe anti-A1, and that is why you are getting the reaction there. And I said one of the ways to differentiate that is to do anti-A1 letting test. Okay, that can help to differentiate that. Now, I've said it could also be due to cold autoantibodies or allo antibody. Now I'm saying that when you have a non-specific, whether it is cold or autoantibody, non-specific, okay, now that non-specific reacting antibody, could be able to interfere with the reverse grouping, whether it is that non-specific could be either allo antibody or it could be cold autoantibody. Remember, so if it is allo antibody that are non-specific, that non-specific allo antibody may interfere and in that reverse grouping, give you that false reaction, or it could be cold autoantibody, which can also mimic that very A1, anti-A1, and then give you that very false reaction. Now, another reason why, of course, if you want to correct that, you have to then pre-warm the sample to dislodge it if you think it is cold antibody, okay, but that is by the way. So if it is definitely cold antibody, if you warm the sample, it's likely that it's going to correct it. Anyway, it depends on how strong that very antibody is. But again, another thing can be the person's condition. If it is in a case of maybe high proteins, like in a case of multiple myeloma. So if in a case of multiple myeloma, which associated with a number of high proteins, and that can also interfere on that very result. And like I've mentioned, technical errors can also lead to that. Now, let's go back. So I've explained how cold antibodies could contribute to that. I've also explained that the technical error can contribute to that. And of course, acquired B is not really the answer. But the one I will go for is group A with an allo antibody. I strongly believe that this person is blood group A, and this person has developed a non-specific allo antibodies, which has now interfered with that very anti-A. Does that make sense? But don't forget that cold autoantibody can also lead to that, because in a cold autoantibodies, so it may also react under the room temperature, okay, and though it's a cold autoantibody, it may react under the room temperature, therefore interfering with that very reverse grouping. I have mentioned as well that sometimes it may not be any of this, it could be due to human error or technical error, and that can also lead to that. But back to this question, okay, now I am going for blood group A with an allo antibody. I strongly believe that this person is a blood group A that has developed a non-specific allo antibodies that may have been interfering to what? Interfering to anti-A, thereby giving that very anti-A result positive. While it is not really because the person has got anti-A, is that the person has got a non-specific allo antibody that is interfering with the A1 cells and then react with that very A1 cells to give you that very positive on anti-A. I hope that makes sense. Okay, now let's go back to this question so that we can bring all of these things together. Okay, now a patient has a forward type of group A, but the reverse type shows anti-A. What is the most likely cause? Not the word most likely cause, because most of the things here are likely to causes. What are the most likely cause? The most likely cause, like I've said, is group A with an allo antibody. Remember that blood group A is supposed to have antigen A, antibody B. So if you are having anti-A in the reverse grouping, the chances are this patient that is blood group A has developed a non-specific allo antibodies that has interfered with the A1 cells and thereby give us that positive anti-A that you are seeing that. And I also did mention that cold autoantibody can cause that as well. Sometimes you might see cold autoantibodies that react at the cold temperature. You may be surprised as well that they can react at the room temperature as well, thereby interfering on the reverse grouping. And of course, I say it could be due to technical error. But what I will go for here is D, which is blood group A with an allo antibody. I hope that makes sense. So let's go. A patient has a forward type of group A, but reverse type shows anti-A. What is the most likely cause? A, technical error. B, cold autoantibody. I've told you that they can cause it as well. C, acquired B phenomenon. Okay. D, group A with an allo antibody. I said I'm going with group A with an allo antibody. Reason being that I believe that because of the forward grouping showing me that this person is blood group A, now the reverse grouping showing me anti-A, there's a possibility that this patient is blood group A but has developed a non-specific antibody that has interfered with the A cells, thereby giving that positive reaction on anti-A. I hope that makes sense. All right. Thank you very much for listening. Do let me know what you think about this video by putting a comment on the comment section, okay? And of course, if you do have experience and you think there's something I could have explained better, feel free to put it on the comment section. I'm sure it's going to help someone that come across this video. Please, can I ask you to like, share, and subscribe? Thank you very much, and I wish you all the best till I come back your way again. Bye-bye.